Do you know that patients with allergies report also higher levels of anxiety and depression? Patients with hypertension happens to have higher depressive symptoms than patients that they do not have hypertension. Also, patients with urticaria, an allergy or inflammatory disease, many of these patients, up to 30 to 40% of them, also met criteria for symptoms of PTSD. This is Dr. Marcos with QHS. And these symptoms might not be related or may not sound related to each other. These conditions might not sound related to each other, but that's not further from the truth. In fact, many conditions that affect your physiology, your physical health, also affect your mental health. But it doesn't stop there. Also, mental health conditions and mental health illness could affect physical fitness. For instance, we know reports of patients with serious mental illness like schizophrenia and bipolar. Those patients are 3 to 4 times more likely to suffer from arrhythmias, and this is independent of the medications they use for the mental condition. We also know that patients with uncontrolled glucose levels, A1C levels high, and diabetes, they also report higher depressive symptoms. What we can do about that? Well, in QHS, we have several tools to unveil those symptoms and to put them into context and to basically bridge the gap between physical illness symptoms and mental health symptoms. So these relationships are very important to take into account as we treat our patients. So QHS have the tools to identify patients that, despite coming in to the clinic with a chief complaint of back pain, we also can look into how that is affecting their mental health. In this case, could be depression. So if you want to know more about these tools, contact me, contact us as QHS. We'll be more than happy to talk about how the QHS suite and digital medicine tools can be used to improve your clinical decision making, also help engage your patients, and when not, generate additional revenue. See you next time.